Hi, I'm Dr. Scott McDermott. I'm a urologist who lives in Greensboro, North Carolina. I actually subspecialize in urinary incontinence and treat people with bladder dysfunction and pelvic floor disorders. This video will help you understand urinary incontinence through the use of an analogy. Urinary incontinence is the unintentional loss of urine that affects over 200 million men and women worldwide. In a normal or typical bladder function, the bladder works together with the nervous system, including the brain, spinal cord, and nerves, and this controls urine storage as well as elimination. To understand urinary incontinence, think of your bladder as a balloon. The bladder works like a balloon. In order to be continent and to store urine, the balloon fills and its stem is shut. During voiding, the balloon contracts and the stem opens. It's that simple. In women, 3 things go wrong with the balloon, resulting in urinary incontinence. The first is bladder spasms, and that as the balloon fills, it has an involuntary spasm or contraction. This uncontrollable contraction results in urgency, and if you don't get there in time, urinary incontinence. The second problem with the balloon is a weak pelvic floor support system. The pelvic floor is like a hammock that holds up and supports the balloon. If it's weak, when you cough or sneeze, the hammock drops, the balloon drops, the stem opens, and you experience urinary leakage called stress incontinence or leakage with coughing, sneezing, and bending. The third problem with a balloon is a leaky valve or bladder stem. Even though the balloon can be very well supported by your pelvic floor, if the balloon has a leaky stem, it will also leak with coughing and sneezing. So there are 3 common causes of urinary incontinence in women. Bladder spasms, giving you urgency. If you don't get there in time, you leak. Loss of pelvic floor support, and this will cause leakage with coughing, sneezing, and bending, and also a leaky stem, which will give you similar symptoms. Many patients actually have a combination of these problems as it relates to the balloon, resulting in what we refer to as mixed stress and urgency incontinence. In addition, in a small percentage of women, they actually have a 4th reason they leak. Some women don't empty well and the bladder spills over like a full glass. Poor emptying of the bladder also aggravates the other 3 causes just mentioned. In men, the same issues of bladder spasms and poor emptying are causes of urinary incontinence in them. In addition, many men following prostate surgery can have a leaky stem and they can experience urinary incontinence with coughing, sneezing, or bending, which we refer to as stress urinary incontinence. We hope this animation helped you better understand incontinence and some of the symptoms of overactive bladder that you may be experiencing.